No.
Hi, I'm Hannah, and this is my informative speech. Imagine someone close to you. It can be your mom, your brother, or your best friend. Now, imagine that person in immense pain multiple times a week or even a month. Imagine them in bed in a dark room, hiding away, not being themselves every day. This is how many people have to act when they have a migraine. According to the Academic Press Dictionary of Science and Technology, migraines are a neural condition characterized by a severe recurrent vascular headache, usually on one side of the head, and often accompanied by nausea, vomiting, and photophobia, sometimes preceded by sensory disturbances. Unfortunately, migraines are a common problem in America. It's likely everyone listening to this speech knows someone affected by migraines. That is why today I'd like to talk to you about the causes, prevention techniques, and treatment options of migraines. So first, it's important to recognize the causes of migraines and other types of headaches. So tension headaches are extremely common, and they're actually the most common type of headache. And even though they share symptoms with migraines, they're different. These tension headaches are caused by stress. So if you feel like you have a headache, you should evaluate your life for any stressors because it's most likely this type of headache. You should look for symptoms such as neck pain, back pain, and head pain, especially if your head feels like a tight squeezing pain. And if these symptoms exist, it's likely you're experiencing a tension headache due to your stress. On the other hand, causes of migraines include caffeine, loud noises, genetics, head injuries, bright lights, and straining your eyes for long periods of time. I have a printout of some more detailed migraine symptoms that I'm going to pass around at the end. So for too much or too little caffeine can cause withdrawal symptoms, which can induce a migraine for you. Loud noises and bright lights can trigger a headache, which can then lead to a migraine. And then genetics and head injuries are extremely common causes of intense migraines. So according to Michael Russell and Jess Olson, first-degree relatives of people with migraines had a 1 to 9 greater risk of migraines than the general population. And along with that, in 2016, the Encyclopedia of Women's Health said that at age 40, 26% of women will have at least one migraine over the course of a year, compared to only 8% of men. So that being said, women and women at over 30 or over 40 are extremely more likely to have migraines. So once you've identified the causes of migraines, you can then try to prevent them. And while some aspects, like genetics, can't be prevented, you can still try to take care of your body and help it as much as possible. So vitamins are a great way to help your body out, especially with headaches. Vitamin D can help your body overall, and it's one of the primary vitamins prescribed by neurologists. Migravant is a migraine-specific vitamin that is a combination of the top things that your body craves that neurologists also prescribe for you. And then eating a healthy diet is, again, good for you overall, but also good if you are prone to migraines. Along with that, avoiding caffeine, or at least reducing your daily intake, can be beneficial. Reducing your sugar intake and increasing fruits and vegetables can help as well. And then according to Sandra Blakesley of the New York Times, new research is showing that a long-debated idea that food allergies may cause migraines, and a majority rather than a minority of people who have had headaches. So studies in the United States and in England over the past 5 years show that 75% of the migraine patients they studied were allergic to 5 or more foods, and some patients were actually allergic to 20 foods. So that's something that they should actually be studying more, because that is a huge percentage of patients. So along with food, drinking water obviously is extremely important for everyone. And lastly, if you have chronic migraine issues, preventative medicine can be prescribed for you. Taking a once or twice a day migraine medicine can help some individuals live a really healthy lifestyle. So now that you know the causes, we can go over some of the preventative treatment measures. We can go over some of the treatments. So the most common treatment is a low-dose migraine medication, and as I mentioned before, preventative migraine medication can be taken. And then there's also medication you can take at the onset of a migraine, such as Excedrin migraine, which I have with me here. This is an over-the-counter example. This is stuff like Tylenol is the lower equivalent which you take for back pain, but this is specific for migraines. And then if this doesn't work for you, you can try some prescription migraines, some prescription migraine medication that someone can prescribe for you. So there are other treatment options if you don't like taking pills, or if it doesn't work for you, you can't find something that helps. For example, Botox is something that's a growing treatment option for migraine patients. The needles that they use actually go into specific parts of your brain, and they can inject medication directly where they need to be. The downside of this, however, is that you have to go in multiple times a year or a month, depending on how many treatments you need, and some people are just against needles and won't do it. Similar to Botox, acupuncture can be used to help reduce your pain. And then, according to Colleen Venestra's research, different forms of patient care, such as using headache nurses instead of physician assistants in ERs, can reduce migraines in patients. So now that I've talked to you about migraines, I really hope that you feel more informed and better prepared to help a friend or a loved one of yours dealing with this illness. Many individuals in the United States do suffer from this, but they still have to function every day, go to school, go to work. So hopefully one of the options I mentioned can help a friend or loved one of yours. Thank you.